Welcome to the Birth Journeys podcast. I'm your host, Kelly Hoff, BSN RN. I am a wife, a mother of two, and a nurse specializing in the care of women and newborns. In this podcast, we will share powerful journeys of birth givers with the goals of lifting the veil on the birth experience, healing through sharing, and beginning an open conversation to strengthen trust and promote transparency between birthing people and healthcare providers. Hello. Today I have with me Charnice, Charlie, Marshall. Charlie is a doula, is currently in nursing school to become a labor nurse, and is here to tell the birth stories of when she delivered her two boys. If you would like to learn more about Charlie's work as a doula, go to www.birthlovecare.com. Charlie, welcome, and thank you for joining me.
Thank you for having me, Kelly.
I'm so excited to hear your birth stories.
Two very interesting birth stories. They were complete opposites. So with our oldest son, Julian, he was a surprise. And, surprises come with things. We didn't have any complications with our pregnancy, just some regular morning sickness and things like that towards the end of the pregnancy. So for the most part, conception was easy. Both babies were actually surprises. Julian, the baby who treated my body well, we had a great pregnancy. I was that mom. I was pregnant in heels. I was wearing dresses. As soon as the summer came out, you could catch me and my baby bump in a bikini. And when it came time for delivery, he just wouldn't budge. So my midwife decided that we were going to induce. I did not want to be induced. Oh my goodness. I tried to do everything. I I could possibly do to send myself into labor. I walked the Woodrow Wilson Bridge. I jumped backwards in my driveway in a full moon. I did everything except castor oil because the stories scared the heck out of me. But we got to induction day and I went in there and I thugged it out. I was 4 centimeters when I walked in the building, and that was at 12:15. By 12:30, I was in the bed with an IV, questions asked, database done. By 1, I was getting side attack or cervidil, something. And at 4:19, I had a baby. It was amazing. It's almost like you don't want to tell anybody that because, I did not have an epidural. I decided from the moment we found out we were pregnant with Julian, I decided that I wanted to do it all. We didn't know if we were going to be able to get pregnant. We had a health scare earlier in the year, but I had decided early on, I don't want to get an epidural. I want to see how far I can go. But I did mentally prepare for it. So I worked with an amazing midwife. She cared for me very closely. We became friends. And when it was time to push, she said, listen, straight into your bottom. It didn't matter because what I was feeling from being a natural pushing mom, it was perfect. It felt so good to push. It felt so good. I can almost feel it right now.
You're so silly. Get that baby out.
It was I don't want to stop pushing. It felt so good to push. And 3 pushes and he was out. And this baby was born on call. I never ruptured. He was born in his sack. His father fainted. So my mom cut the cord. It was amazing. And then you have our youngest. And they say that the second child cares nothing about you. And if superstition is true, this one proved it to me. I had hyperemesis for 30 weeks with our second child.
I remember that.
It was awful. Oh my goodness, it was awful. I don't know how I made it through. But we decided that at 39 weeks, we were going to go ahead and induce, although I was scared of an induction. And I was that mom who wanted the dramatics. I wanted to be at Tropical Smoothie in my water breaks or, it's so dramatic. I wanted to be in the mall and I just go into labor or you're sleeping in your water breaks. But we decided that at 39 weeks, we had to induce. And lucky me, 39 weeks landed directly on our first son's birthday. So now we have 2 babies with the same birthday. My labor with Sion was different. They put me on Pitocin. They did all the things, which they didn't have to do. It was 10 of Pitocin. I had a baby in 4 hours. It was almost like the first one, just no pit with the first one, but it was beautiful. Warren did not faint, thank goodness. Warren actually explored the placenta after. He cut the cord. He did skin to skin. Like the second experience was just so, it was the same and different in so many concepts that you can just appreciate for, them individually. And if I have a third, I think I'm going to choose to go unmedicated again. I fully stand by my decision personally to do it unmedicated. And I mean, now you can't tell me anything because I really do believe I'm Superwoman. So there's that.
Yeah, you are though. You are. Were you a doula with your first?
Yes.
Okay. So how long had you been a doula at that point?
I had been a doula at that point for going on 5 years unofficially. Like my friends would have babies and I'd be like, no, you don't have to get the epidural. I'm going to help you, you know? So at that point, I considered myself a doula, which once I went through my training, they assured us that we were doing it.
Yeah.
So.
And then, so what do you tell moms, or what do you do for moms to help them get through labor and delivery without the epidural?
It's all in, everything is particular to each client and what their need looks like. Some women go in and they've done all the things. They've done the hypnobirthing. They've done the Lamaze. Some moms have taken spinning babies themselves, things like that. It's all in the individual's client's needs. They're looking for more emotional support so they can get through it mentally, because some people run a marathon by mental training, If it's that, then that's what you do for them. You give them the affirmation, you give them the reassurance, you just give them that type of support. Now, if you have a mom who's like, I know I can do it, I'm doing the yoga, I'm going to the chiropractor, I'm this and I'm that, I just need more physical support, then that's when you want to whip out your tools and you want to crack your knuckles and get in there and do all the things, and get your rebozo, all those things. So I think it's just individual to each client. And I think that's another reason to have a birth plan. Just one of the reasons to have a birth plan, because we can do what's individualized to you to help you make it through.
So then when you prepared for your first birth, what was it that helped you get through it mentally?
So for the first birth, I got some hypnobirthing tapes. I didn't know too much about it, and no one that I knew too much about it, but I found some things on YouTube, and I trained my cousin on how to be my unofficial doula. I showed her where like the pressure points were. We did breathing together. I showed her the mechanisms for the fall, how to support me in squats, things like that. I just kept telling myself, you're no punk, and I don't like needles, so you were not sticking one in my back. That was the driving force. No one was going to stick a needle in my back.
It cracks me up who would rather have a baby come out of their vagina than have a needle in their back.
And the crazy thing is, my first exam with my midwife, she was like, oh, I found piercings. Are there any more?
That's funny.
So it's like, those are fine. You're not sticking a needle in my back.
It's the back. Yeah, the back is kind of...
it's just simple to sticking a needle in my eyeball. It's just, we can't do that.
I don't think it's as bad for me, but I definitely jumped off the table.
You see?
I annoyed the anesthesiologist, for sure.
Yeah.
So then for the second one, did you prepare any differently?
I did. I hired a professional doula. I did more physical work. I saw a chiropractor starting at 20 weeks to try to at least help with some of the nausea and vomiting, which at that point it helped, but it didn't completely subside. I actually purchased the hypnobirthing tapes, and it was completely different than what I thought it was going to be. Like, oh, there's just something that you listen to and it's going to hypnotize you and you're going to be able to do it. No, there are tapes to help you sleep. There are tapes to help you. Like, it was so many. You prepare like over time. So I did that. And I was very vocal with my midwife and my care team, so I could feel like I was going to be successful, and they heard it. I mean, even in the delivery, the doctor was saying things to me that I had said to her months before, like, no, remember? So I feel like those things, just being open with my care team and being open with myself about how far I really knew I could go, it really helped.
Yeah. And so then when it comes to pushing, everybody has a different experience. When you have an epidural versus when you don't have an epidural, it's also very different. So what helped you kind of click into exactly how to push?
When my midwife looked at me and told me to get it out of my face and put it all in my bottom, she told me to take a really big bowel movement. And at that point, I'm like, I'm good at that, so thanks.
If you have ever suffered from constipation, now is your moment.
Oh my goodness. And pregnancy will offer you some constipation.
Oh, for sure.
So yes. So when she said that, it was like, oh, there. Because when you say push, And when they tell you to hold your breath like you're going to dive into the pool, you're like, okay. And then it's like, wait, don't pass out. Get it out of your face.
Right.
Put it in your bottom.
Push it all the
I was
way
like,
down.
okay, boom, I got it. Yeah.
So I've seen moms when you tell them to push, like you have to poop. Some of them get it and that helps them click in. Some of them try to go away from that because they don't want to poop.
Because they don't want to poop or because it hurts?
Because they literally don't want to poop.
Okay. Yeah. I'm sorry, princess. The baby's young.
Guess where your baby's head is?
Right. Literally. I'm so sorry.
Yeah. If there's poop in your body, it's going to come out.
Like even in the delivery room, I tell moms, I'm like, hey, so I just want to let you know that you are pooping in the right spot. There are things that tell me that because they don't want to hear.
You mean pushing in the right spot? Not
yeah.
I'm
sorry. You're not pooping in the right spot, but you're pushing in the right spot because there are things that tell me that, you know, they don't want to hear that they've pooped, but you're doing good.
Sometimes they figure it out just based on the smell in the room, but no one cares.
No one cares. Like, that's what we want. It tells us that, oh, okay, like you are doing it, right? And that you're not just.
And your baby's probably not going to land in a big puddle of poop. We're going to clean you up.
We're going to make sure that they don't do that.
Yeah.
Like, you know, we do specialize in dignity.
So when you're preparing a client for delivery and you've talked to them about their goals and whatnot, do you just send them to the route that you think is going to help them the best, like whether it's Lamaze, hypnobirthing, that kind of thing? Or do you have them train in a variety of things? How do you plan for that?
So I never like actually just send them. I always break things down to them and tell them what their options are and what I recommend. I recommend for every client, whether they're having a C-section, whether they know they're going to get the epidural and they just want me there for whatever, whether they want to go, no matter what, at 20 weeks and beyond, I always recommend they see a chiropractor.
Yes.
You know, it helps in so many different ways. Right. You can reduce the rate of a breech baby. You know, it helps you feel better overall because you're growing an entire human inside of you, you know? And yes, so based off what they need, I'll give them what I know. And I'll tell them that it's their decision, but I am here as a resource for you. So if you have any other questions, let me know, and I can do the research or suggest something based on what you need.
Are you pregnant and planning a hospital birth? You don't need a birth plan. You need a birth vision. In my opinion, birth plans set you up for failure. Yep, I said it. Hear me out before you turn off this podcast. You may think that by downloading a generic birth plan, it means you're in control. The truth is, it's not that simple. No one can control exactly how their birth will go. There are way too many variables. What every pregnant person wants is to walk into the hospital pregnant and to walk out with a healthy newborn in their arms. The journey in between is the murky part. It's hard to know what issues might come up that need to be addressed. If you focus your energy on a birth vision rather than giving your power to a birth plan, you can empower yourself to make the best choices for you and your baby. That's why you need to get into my Empowered Hospital Birth program. As a labor nurse and mindset coach, I can help guide you through the process of maintaining the calm autonomy that will help you achieve the birth vision you desire. In my Empowered Hospital Birth program, I will help you identify the source of anxiety you have surrounding hospital birth. Fill in knowledge gaps to make sure that you are fully informed and confident. Learn key phrases so you can better communicate with your medical team. Emotionally process your fears so that they don't hold power over you. Go to kellyhoff.com/empowered to book a free 30-minute private birth vision call, where we will identify your top fears and must-haves and gain clarity on exactly how you want to feel in the birth space. That's KELLYHOF.com/empowered. I'm honored to be a part of your birth journey.
Yeah.
So if you could go back and talk to yourself before you had your first baby so that you could prepare for either that birth or the next birth, what would you tell yourself?
Sleep the night before. Don't be up anxious. Just get some rest, because until you go home from the hospital, that's going to be the last time you sleep.
What do you mean until you go home from the hospital? You're not going to sleep when you get home.
I mean, at least when you get home, there's, depending on what your family is, there's a mother-in-law there ready to receive the baby and take over so you can take a shower or take a nap, or, you know, a husband who's just ready to, a partner or whoever who's just ready to maybe have their alone time with the baby.
Yeah.
I just foresee, depending on everyone's situation, at least for my own, take a nap the day before, because until you come home from the hospital, you are not going to sleep. The pediatrician's going to come in, your nurse is going to come in, your doctor's going to come in, the baby's going to come out.
Yeah.
And then the hearing test and the lactation specialist and fundal checks. You're not going to sleep.
It's a lot.
Get some rest.
Yeah.
And just go with it. Don't stress over
definitely.
it. Yeah.
So when you're in the hospital, and I'm assuming you've had clients at multiple different hospitals.
Yeah.
As a labor nurse, sometimes it is difficult because the policies of the hospital and expectations of nursing and medical staff are a little bit different and a little bit more medicalized than the expectation of a semi-straightforward natural birth. So how as nurses, especially now you going into nursing school, how as nurses can we help with these natural births with or without a doula to support the mom, given our restrictions?
Given the restrictions, I really just say hear and advocate, because hearing is one thing, but action is another thing, right? And sometimes because we are stuck within the guidelines or we're stuck within the restrictions of the hospital's policy, sometimes we just hear it and we don't attempt to take action, because we've been there, right? We know that some providers are more lenient, some providers aren't.
Yeah.
For example, if we have a mom who's having an unmedicated birth and she is telling us what she feels, and we know that if we hear, oh, I'm feeling constant pressure, that tells us something, right? If she doesn't know how to express that, if she's not feeling what we think she should feel, it shouldn't be disregarded.
Yeah.
We should further investigate.
Right.
And that's what I mean, like with them being stuck in the gut. Now, if it's something of, oh, I want to have my baby standing up in the middle of the floor, if we know goodness well that our hospital policy is you can have your baby standing on your head as long as it's in the bed, like whatever.
Yeah.
It has to be in the bed. Like I can help you. We can figure out all the different ways.
Gravity's not going to help you if you're on your head, but yes.
I mean, but like we've seen it. Like we get some very interesting requests.
Yeah.
So it's just like, I don't know. I just feel like hearing a patient and a client and putting action behind it really helps. Advocating really helps. That's what makes the difference.
As far as culture, and I'm guilty of this, so I'm just going to throw this out there. There's a mom screaming down the hall, right? And the door's shut and you can still hear her. And maybe that's how she's coping, maybe not. I hear a lot of comments at the nurse's station. What do you recommend?
I'm going to say that I'm guilty as well.
Right.
Okay. Every time. Okay. Especially when a patient rolls through the door, the first thing I say is she's either complete or she's won.
Yeah.
That's the first thing I say. Other than, us going, obviously we'll go down there and figure out what's wrong.
Right.
But for the ones who don't go and figure out what's wrong, I mean, it doesn't hurt anything.
Right. It's uncomfortable. It's like you have to break the tension with something.
Yeah.
I think a lot of it is just, medical staff humor, because we've seen so much. We get a little bit nervous, like, is this going to go well or is this not? So let's break the tension. But I mean, personally, I was guilty of being that person screaming in labor. So I'm a little sensitive to that, because I think everybody has a different, I don't want to say pain tolerance, because I don't think that's fair. I think everybody tolerates what they can tolerate, but everybody has a different anatomy. And we learn in nursing school that one of the worst pains is bone pain. And that includes if that baby's bone is pushing on your bone, just because it's malpositioned or whatever. And having had 2 babies that came out occiput transverse, or at least the second one turned with the vacuum, but...
But you mentioned vacuum, so we're back at square one.
Right. Nothing was comfortable for a long time.
Nothing.
Right. So
oh my goodness.
I felt like both times at about 6 centimeters, I started getting really pushy because they were low in a funky position.
Yeah.
So everybody copes a different way, and not everybody's equipped to figure out what positions work best for labor. The first time I was in a stretcher when I got to the hospital, I was comfortable at home. I was in a stretcher when I got to the hospital, and that was hell. And not really knowing where to go to reposition and get into a better pattern. And then with my second, we have the rocking chairs where I delivered, which game changer. Oh my gosh. Nice. So I just feel like offering maybe some guidance and support and positioning is helpful.
Yeah.
But like you said, definitely get in there and see what you can do, because
yes, you just get in there and see what you can do. And I mean, I want to piggyback on what you said about that's how you cope, because whether she's complete, whether she's one, maybe her screaming the F-bomb is what's getting her through this contraction.
Right.
It may not be like an emergency, because sometimes you hear screaming and you're like, who's dying? Oh my God. Right? So it may not be an emergency. It could be like how they cope. Get in there. That's the point. Get in there and see what you can do to help.
Yeah.
Because it could be just, hey, did you know if you sit on the ball, it'll kind of, you know?
Yeah.
Right?
Exactly. I was going to say, evaluate. Is that how they want to cope with the full 10 centimeters if they're one, you know? Maybe some other options.
Exactly. We do have patients that'll say, I just want to be checked to know where I am. That'll tell me if I can go any further. Yeah. But I do tell at least the natural patients, like when you get to the point where you absolutely know that you can't do anymore, have baby.
Probably.
Yeah, probably have baby.
Yeah, unless they're malpositioned like mine.
Unless they're malpositioned. And
so fun.
Gosh, Kelly, now I take my superwoman back.
Yeah, and that's when I got epidurals both times.
You get the superwoman.
Nah, I got the epidural. I was like, nope, this bone pain sucks.
But you vacuum, honey.
Also that.
Vacuum. No. No. And that's another thing when I say like that my provider heard me when she put Sion on my chest, our second baby. It was like, normally people are like, oh, baby. I looked at her. She looked at me and she was like, you're good. She knew what my concern was. So now I can embrace my baby. Like
anything going on down there? No, we're good.
Because there is no epidural. So you are going to feel everything. And they're like, oh, we'll give you lidocaine. And it's like, yeah, but I have to feel that first.
That is
not
the
really
problem
fair.
with lidocaine.
Like there's no win. Like there's no win. I have to feel that first. No.
Right.
So
I remember the dental floss feeling with my first, because my epidural was light, right? I was tolerable, but it was light. I felt all the things. I felt the ring of fire. I felt the contractions, and I felt the dental floss going through when they were, but luckily I did not feel the sharp pain of the needle. That is the only thing I didn't feel. But it just feels like they're flossing your vagina.
Well, let's talk about repairs. What's with this dad stitch?
Oh, stop that.
I mean, what is it? I was given one.
No.
And I was given one, and I was told that I was given one. And at that point, I knew nothing about what a dad stitch was. It was literally like, okay, honey, and just another for your husband. And I'm like, what?
That doesn't help anybody.
When I found out what it was, and like I said, I loved my midwife. But when I found out I was like, the hell entitles him to anything here?
Well, and the thing is, like, if you're doing that, most people, the dad stitch is right at the introitus, which is just the entrance. It just makes it hurt more and harder to get in. So how does that help anyone?
Well, let's see. I've reaped the horror of that, but it is what it is. I can't go back.
No,
so
no, you can't.
Birthing people, if anyone mentions a partner stitch,
politely
tell them to take it for themselves. Tell them to do it on themselves, because no,
it's not good. Not a clinical thing.
If they want a stitch, they can go next.
Right.
They can put their legs in the stirrups.
Correct.
They get their stitch.
So in our country right now, there is, you could call it an epidemic, a history of poor outcomes for birthing people of color. And I think that as providers, we need to be aware and we need to search for ways to improve those outcomes. What experience and thoughts do you have as a woman of color and how these outcomes are occurring?
You know, it's very unfortunate that women of color are not afforded the same healthcare opportunities. And it's like, yeah, we can go to the same doctor, but are things being explained to us in the same manner? Specifically for those practices who target women of color, and especially in the impoverished communities, when they're not completely honest. You know, you open these clinics and you're caring for these women while they're pregnant, but you're not open and honest with them, telling them that they won't see you at delivery. So they're going to deliver with someone who knows nothing about them or their medical history. We have women of color who are not even being told by their provider simple things like take baby aspirin during your pregnancy. That's specifically why me in my practice, in my doula business, I never turn away a woman of color because of money, because we are our biggest support at the moment until we get things turned around in this country, until we are heard, until our concerns are heard, until when we say things don't feel right in labor and delivery or after surgery or whatever it may be, that we get to go home with our babies because someone came and investigated what was wrong. Someone came to find out why there's blood in the Foley bag, why legs aren't being felt, why blood pressure is so high. When we're complaining and saying that things hurt and this doesn't feel right, don't label us as angry and as complaining, because our concerns are just as valid as anyone else's. Hear us and take that action, and that can be the difference. That could save us and our babies. That can have moms and babies leading together.
Do you remember when we took that class talking about the cuss words?
Yes.
Say, I'm concerned, I'm uncomfortable, and this is a safety issue. And I feel like it doesn't happen very often, at least where I practice. But when I have concerns and when people want to kind of just say, oh, it's no big deal. If I have persistent concerns, I feel like using those words and saying, I'm concerned, I'm uncomfortable with this situation, I believe this is a safety issue, I feel like I get heard a little bit easier and it's easier to assert myself. And so I feel like if everybody had those tools to be able to speak like that, it's not as aggressive as some other things that we could say. And people tend to take you a little bit more seriously.
Yeah.
But yeah, I just think that investigating concerns, it doesn't hurt, Even if that person has been having the same concern over and over and over again, maybe you're just not going to find the reason for that concern until you've investigated it multiple times.
Exactly. And I think that's one of the main reasons why doulas or anyone, any type of support that knows the red flags or the warning signs or things like that. Because what I tell any client, woman of color, birthing person, period, if I've taken this time to get to know you since early pregnancy, and here we are, and you've had these concerns and things are being said to you, I tell my clients what it is. I'm like, listen, vaginal checks opens up opportunity for infection. If you want to be checked every hour, if that's your wish, that's your wish. But I say things to them like, I'll remind you to say, are you okay with that? Can you tell your provider what you're feeling like you told me how you're feeling? I think that's one of the most important things about doulas, because we take the time, we spend all this time with our clients and they come into labor and delivery. Maybe they're there for 3 days, maybe they're there for 12 hours or less. But we've taken this time to figure out the things with each other so that when you're in the labor and delivery room and you're saying like, ouch, this F-bomb hurts. And I know that you've never been, at least in the past 6 months that we've been working together, you've never used that type of language or things. I'm like, oh, well, hey, Kelly, this is outside of you. Is there something that you want to say? Like, there has to be some type of helping to advocate. Everyone doesn't know how to advocate for themselves. Like, hey, I don't think that this pain is normal. I encourage you to talk to your provider about what this may be. I had a client at a hospital that I will not disclose, woman of color. She was an attorney. And she continued to say, my pain is here and it wasn't there before and it's getting worse. The nurse just kept saying, it's okay. It's time for delivery. That's what it is. You're having a baby. And as you get close to, because that's what science says, right? That's what we're groomed to say. When the closer you get, there are going to be some pains that break through your epidural that we just can't control. We know that that's true because that's what science says, but there was never an investigation. After she had her baby and they went to take the epidural out, the catheter had already come out. That's why she was feeling the pain.
Crazy.
Right? That's why she was feeling the pain.
Yeah.
It was time for her to have a baby, but the epidural catheter had already and the nurse says, yeah, we've been having that problem with this anesthesiologist before. And it's like, and you know that you've been having that problem, so check the back. It's just all about not being heard. I don't need to listen to you. I don't need to hear you. I don't need to take action because science said, and I know because it happens every day, every day on my 3-day shifts, that pain just breaks through the contractions and you're going to have a baby. We know that. But there was also something else that could have helped her cope with that pain. So I just encourage any woman of color, speak up.
Yeah.
And don't back down. and you don't have to be nasty,
Right.
but speak up, know your rights. I encourage every woman to research their birth rights because that's real. Like every woman has birth rights. That's your body. It's your property. It's your right.
Right. Yeah.
So.
You talked earlier about birth plans. So we know that your birth plan didn't completely come to fruition.
No.
So what do you tell your clients when you're preparing them with a birth plan? What do you talk to them about what they can and can't control?
Yes. So we talk about being realistic first. You can't say that you don't want an IV. You can, but you can't.
But are you really helping yourself when you say that?
Right. It's like, because anything can happen. And in a state of an emergency, you want us to have access or your providers to have access to anything. I just tell my clients to be realistic. You absolutely can say, instead of me doing skin to skin, I would prefer you give the baby to my partner. You can say that. You can say, I would or wouldn't prefer erythromycin or vitamin K. Is that an informed decision that you're making?
Yes.
Do you know? But you can say that. You can't say things like, I want to deliver my baby while I'm in the middle of a flip because I'm a gymnast and it's going to look good for my social media. Be realistic, right? Be realistic. You can say, I would prefer to have no donor blood. There are forms and consents that you'll sign for that. But, those are in your birth plan, you just really want to be realistic. I would prefer if you didn't wipe the vernix off my baby so we could bond. You can say things like that. You can say, I would prefer a baby stays with me at all times unless it's safer for the baby to be in the nursery or the NICU. I would prefer to have the bath done in front of me, depending on whatever the hospital policy is. Your nurse can try to accommodate something. Just be realistic and know that your health team, your care team is going to do what they can to, as long as it's within safety and within policy. But don't think that because you put it on paper that unicorns are going to show up to your delivery.
Right. Yeah. I think a lot of the culture right now, and it's understandably, is women are just trying to take back control, which I get. That's great. And they should. But part of that is keeping everybody safe. And sometimes things cannot be planned. Sometimes we can't tell the baby how to act or how to respond to labor. We also can't tell your body how to respond to labor. So you always make a decision. You always decide, given the facts, like right now your baby is in this very long decel and we're concerned that the baby may not recover. At this point, it's been long enough that statistics show that if we don't go back to the OR, we will have a bad outcome. Believe that. You can decline. I have seen women decline and we've had bad outcomes, but just know when we are doing these things and saying these things, even if you've planned to not have a C-section, things happen. Not to scare anyone, but we use medical technology to save lives. And sometimes we have to do that. And so you're not always going to have exactly what you wanted, unless the number one thing that you want is a healthy mom and a healthy baby. And we'll do our very, very best to accommodate that.
Absolutely.
So we've talked about the whole birthing process. We've talked about your deliveries. How were your recoveries? How was the postpartum period?
Physically, postpartum was, for the most part, other than the retained weight, it was pretty good. I had some pelvic floor issues with my second baby, but I just want to shout out Dr. Shara Posner. Listen, ladies, take care of your pelvic floor after delivery. I mean, let's just talk about wetting a brand new car that wasn't 24 hours old after delivery because I overlooked that pelvic floor. Physically, postpartum, it was pretty good. It was mentally that took me a little over a year after both babies to bounce back from. Postpartum attacked me hard. And I thought that I was going to be more prepared the second time because it's like, but why not make a cocktail out of it? Why not mix 30 weeks of hyperemesis with, a little bit of postpartum? It was awful. But the one thing that really got me through in both pregnancies that I noticed was the sun. Every day I got up and it was an opportunity to take a walk, as long as the sun was out, my front door was open, my blinds were open, and I was happy. For the most part, the random outbursts of crying and checking and anxiety and all that good stuff it could have gone away. But then at night, all the intrusive thoughts and resentment and everything just piled up at the bottom of my bed and stared at me throughout the night. I just could not wait for the sun to come back up.
Yeah. Did you end up having any treatment for your postpartum symptoms?
The second time I did talk with my provider, and she prescribed me nice things. My postpartum anxiety and my intrusive thoughts told me that was going to harm my baby.
Oh.
Never got the opportunity to see if the effects worked. Mm-hmm. My thoughts just wouldn't allow me to do it. And when she gave it to me, I was all in. I'm like, good. I want to feel normal. I want to feel better. And I started taking them. And then she was like, yeah, I remembered when she was like, it's just going to take a little while to kick in. And so I'm like, oh God, I'm going to take them. And then I'm going to have to keep taking them. I have to keep taking them. And the thoughts just wouldn't let me refill my prescription. Yeah. So yeah, I thugged it out. And I don't know if that was for the better or the worse. I haven't figured that part out yet. Yeah. I mean, he's 3 now, so We'll see.
Did it go away at a year for both of them?
For Julian, it was like right at a year before fall. Like I remember feeling like myself again by September. With Sion, it was a little like a year and a half actually, because my cycle had came back. So my milk supply had at that moment taken a plunge. I mean, all the things were hitting me. So it just kind of didn't go away. And I think once we made the decision to continue to nurse, I felt better. So,
because those are all hard decisions. Those are all things that you have to, when you have anxiety and have to go back and forth and try to figure out how to handle that, that's so hard.
And at that point it was COVID. So they're talking about vaccines. And I'm like, oh my gosh, am I going to breastfeed him? I'm not. At this point he had broken out from like so many things just randomly, and we couldn't figure out what it was. So postpartum was like, yeah, you got a lot going on. I'm just going to stay here with you for a little bit longer. So you're not alone.
Yeah.
which is great.
Well, I think that also the hormones linger when you're breastfeeding. And then when you stop breastfeeding, there's a whole shift that has to happen. And so then you have this whole other roller coaster that you're going to deal with. And it's just, I mean, I nursed for 18 months, but those hormones stick. That the longer that you're doing it, the longer the hormones stick. And then you have to deal with like the whole shift. And it's like hard to feel like yourself until all that's over with.
Yeah. So if that was January 2021, we decided to stop pumping. I'm like, listen, the factory is shutting down halfway.
Yes.
You can continue to get your supply from here, but it's a direct supply.
Right.
The extra just wasn't a part of life anymore. I just could not do it. But yeah, he hasn't nursed in almost a year. Yeah. He'll be 4 in June. So we're good.
So then did you do any therapy or any other?
Oh, yes. Therapy.
Yeah.
Oh, is that treatment or is that like happy hour? I'm sorry.
Right. Yes.
I love my therapy hour. It's like, kids, I'm busy. Don't bother me. I get to be alone.
Mommy's
I get to vent. I get to cry. If I have never been so consistent in any type of self-care in my life, I will go to therapy. That's what I will do. Right. I encourage it. It's like my insurance will pay you. You'll listen to me cry and you'll offer suggestions on how I could better myself.
Yeah. It's magic.
Wow.
So there are lots of options for how to treat postpartum mental health disorders, right? And some of us get a nice little cocktail of just about everything, the intrusive thoughts, the anxiety, the depression, just everything.
Love it.
And some of us choose medication. Some of us, our intrusive thoughts won't let us take medication.
That's right.
But that doesn't mean that you don't have options. So therapy is an option, just as long as your OB can help you find the option that is best for you.
And you know what? I want to give a shout out to Chandra Burnside.
Yes.
Chandra reached out to me after Sion. It was like, girl, there is this amazing breastfeeding support group and this postpartum support group, and we support each other and we listen to each other. And I enjoyed driving out there from Maryland to Virginia to be with other women, to listen to them vent and express themselves about the same things that I was feeling, and talk about really not feeling alone. It was a group therapy. Yeah. It was, so shout out to her, because that really, really dug me out. It gave me the opportunity to get out of the house during daylight. It gave me the opportunity to be around other moms and other little cute babies. So shout out to her, because she was a vital part of my healing. I don't know how I left that out. Yes, there are options.
Was there anything that happened that made you feel out of control during any part of your labor and delivery experience?
The only part of my labor and delivery experience that I felt like I was so out of control and I could have climbed the wall, that ring of fire, man.
Oh yeah.
That ring of fire, like nothing. You're either like a super OG and you breathe through it, or just go balls to the wall. Like,
right.
Why?
So you weren't the one climbing up the bed trying to get away from it?
I was the one who chose foul language as my outlet, just, I literally, my sister will never let me live this down. I screamed like, it burns, it mother.
Loud enough for everybody to hear, like down the hall, right?
Everyone. Yes. I'm sure everyone was like, whatever she's having, we don't want it. So yeah, that I felt so out of control. I apologized to everyone and
that's okay.
Was reassured that I had nothing to apologize
because
for.
We tell moms all the time that bad words that we've all heard bad words and they're okay in the birthing room.
I tell them this is the space that this is allowed. You can say all the things because I've lived it.
Yeah, we're all grown-ups,
So there's that.
Do you have any funny stories that you want to share, that anything that sticks out? It's like maybe your favorite funny or favorite just general experience?
I honestly think the funniest thing for me was when I was pregnant. My brother was having his baby the same year. I remember her nurse, she had the epidural. She was bawling, crying as she was delivering. And I told my mom, I said, I won't be getting the epidural because it doesn't work anyway. And I swear I can remember, I won't say her name, but T was the nurse. And she said, oh, okay. Are you going to come deliver here? Because I would love to be your nurse.
Was she?
No, she wasn't. No, I didn't deliver there. But just when I think back at how the attitude that I took when I was like, oh, I got this.
Right.
Oh, it's going to be good. Like, I won't be doing that because, And then I got there and I was just like, I literally asked my midwife, can I have a Tylenol? Like, I don't want the epidural, but I do want a Tylenol.
Because that's going to help.
Because, hey, you can't stick me, but this hurts. Like,
I'm going to take that job.
I don't have any funny stories, but why doesn't anyone tell us, like, when is someone going to open up and just tell us all the things? Tell us that we're going to ugly cry. Tell us that we're going to use the F-bomb. Tell us that our nipples are going to hurt. Yep. Tell us that the sitz bath is going to, like, tell us that the spray bottle is going to be our best freaking friend after vaginal delivery. Like, why do people want to say, oh, it's going to be lovely. You should take the matching outfits. You should do this and that. No, boo.
Yeah.
Why you didn't tell me to take some witch hazel? Tell me to rub some breast milk around my nipples so they'll heal. Like, I want to know those things. I'll figure out the cute things later.
Right.
So you have to do one of those. So tell me the nasty secrets. Yeah.
Yeah. I love it. Well, Charnice, is there anything else that you wanted to share that you thought the world needed to know?
No. Other than if your baby was born on February 15th, you are welcome.
You are. Yes.
That baby is the greatest thing that's ever happened to you. And don't let that little one forget it.
Yeah. So crazy. And Scorpios are the devil, right?
Scorpio. Oh my goodness. Please. I hope all of you are miserable on Valentine's Day so no one creates any more Scorpio.
It's hilarious.
Jeez, man.
All right. Thank you so much, Charnice. If you want to connect with Charnice, just go to, tell us your website.
www.birthlovecare.com and get yourself one of the coolest doulas you'll ever meet.
Yeah. And future delivery nurse and future midwife.
And future delivery nurse and midwife.
Let's face it, moms are busy. We're so busy taking care of others that we rarely have time to take care of ourselves. I'd love to simplify that for you. I'm offering a free 15-minute hair care or skincare consult to help you find an uncomplicated routine using clean, vegan, anti-aging hair care and skincare products that follow the strict EU standards for safety. For your free consult, just send me an email at birthjourneysrn@gmail.com and we'll schedule a call. I'm excited to be a part of your self-care journey.
Thank you so much for tuning into my podcast. If you enjoyed what you heard, make sure you hit that subscribe button so you don't miss out on future episodes. Don't forget to share the podcast with a friend who can benefit from the valuable insights that we share here. And if you could take a moment to leave a 5-star rating and review, it would mean the world to me. If you're ready to work one-on-one with me to embark on a transformational journey towards a confident and empowered hospital birth experience, go to kellyhoff.com/empowered and enroll in my Empowered Hospital Birth Coaching Program. Together, we'll create a roadmap to a birth experience that you'll cherish forever. That's KELLYHOF.com/empowered. Let's make your birth experience extraordinary.